Okay. Let's give it maybe 45 more seconds while everyone is joining us. I still see people join by the dozens. Okay. I see hands being raised. You will notice a Q&A functionality on your Zoom webinar panel in the bottom. By all means, use the Q&A functionality. We will be taking questions live. We will try to get to as many of them as possible. But please use that, ask panelists questions, and we'll be trying to answer them. Okay, we are at yeah 5:31, so I think we will get started. So, hello everyone, and good afternoon. My name is Jai Ellison. I am one of the founders of Fort Health. We provide therapy and psychiatry to children and adolescents in New York and Pennsylvania and New Jersey. And we also provide monthly education sessions for free to basically anyone around the world. We try to cover topics that either are under discussed or that are under maybe represented. And this is the second webinar in our Disparities series. Last month, we covered disparities in academic performance between boys and girls with a panel that included Richard Reeves from the American Institute of Boys and Men. I encourage you to visit our website, forthealth.com, to watch the recording. Next month, we will be discussing the disparities in mental health outcomes among Black and Hispanic children and adolescents compared to their white peers. And this month, we are tackling the sustained disparity between girls and boys when it comes to depression and suicidality. So first, let's start from the data. In August, the CDC released its latest Youth Risk Behavior Survey. This data is the de facto authority on the state of young people's well-being. The good news, many of the data points that they measured were heading in the right direction compared to the 2021 results, which caused alarm all over the media and rightfully so. And yet, on the topic of tonight, the results are still cause for great concern. Teen girls are still more than twice as likely as boys to attempt suicide in the last year at 13% versus 6%. Further, 39% of girls report experiencing poor mental health in the last 30 days versus only 19% of boys. It's shocking to have to say only 19. That is still a very high number, but boys are doing much, much better. 53% of girls reported feeling persistent feelings of sadness. It's an improvement of 4% versus 2021, but still, again, on the theme, much, much higher than boys who are at 28%. And last one, 21% of girls reported being electronically bullied in the last year versus only 12% of boys. So what we're going to do tonight is try to understand why the data shows what it shows. How can we, educators, caregivers, healthcare providers, and community leaders support girls? And what systematic changes might be needed to reverse this sustained trend? We have a perfect panel to tackle this. We have Dr. Lindsay Henderson, who's a clinical child psychologist and the clinical director at Fort Health. We have Dr. Omar Guidino, who's a senior psychologist and the deputy clinical director at the Childman Institute. And we have Dr. Dion Smith Coker Apala, who is a psychologist and the associate professor of psychiatry at Georgetown University. She's also a member at the Center for Trauma in the Community, and she is affiliated faculty at Georgetown's newly launched Thrive Center. Thank you all for joining us. If you don't mind, I will be referring to you by your first names. Hopefully
Sure.
we have some level of familiarity. Again, to our audience, I encourage everyone to use the Q&A function to ask questions. And with that, let's go. So, Dion, actually, let's start with you. I am always weary of generational moral panic where every generation of parents thinks that their children are in danger. So, can you put things in context for us? Are girls today more likely to struggle with depression versus girls in previous generations?
Sure. It's a pleasure to be here with you all this evening. And this is a great way, I think, to start this discussion because when we're thinking about generational moral panic, we're talking about this phenomenon where adults in each generation tend to worry excessively about the younger generation, and they're really focused on this unprecedented danger or moral decline as it relates to young people. And sometimes this fear that adults experience the fear is grounded in either overestimating the risk while at the same time maybe underestimating the resilience of youth or just the strengths that they bring. And if we look at it historically, in my generation, when I was growing up, maybe my parents worried about the impact of video games on the younger generation. Every generation had something to worry about. But when we think about this phenomenon of generational moral panic, um, we want to be careful to not overstate the risk, but at the same time, look at the data, which is what you just shared. What is the data saying? What is the data stating? What picture is it painting? And so when we're talking about adolescent depression, particularly among girls, the data shows that girls are, as you mentioned, Shai, indeed experiencing higher rates of depression than those in previous generations. And so why is this? For this generation and for those of us who are parents now, some of the factors may be contributing, may be related to social media, just the rise in social media, greater academic pressures, and things like young people just being more aware of societal issues that impact their lives. And so, yes, to answer your question, the data suggests that girls in today are experiencing rates of depression that are more prevalent than in previous generations. And so again, I would just encourage everyone to think about the balance between overstating risks and also grounding it in the data.
Mhm. Thank you. Um, so Lindsay, next one to you. And this actually our first sort of audience question combined with our question. And let's talk about hormonal changes. So what role does puberty and hormonal changes play in making girls more vulnerable to depression compared to boys?
Sure. Thank you, Shai. So let's keep this high level without getting too bogged down in the overwhelming science of hormones and neurobiology. But the message here, why it's important, is that there is a hormonal and kind of neurological factor here that does play into the risk that girls have when compared to boys. And that is primarily around the hormone estrogen. And estrogen for females is what makes us capable of so many incredible things like creating life and all the other amazing superpowers that women have. So it is not a handicap in any ways, but with any hormone, there's ups and downs, right? So what the downside with estrogen is that it does have kind of like an elevated response to stress. It gets kind of ramped up in a way that puts women more at risk for things like autoimmune disorders later in life and other kind of neurobiological stress responses. So what does that mean? Why is that relevant here? Two things. Chronic stress, as Dion started describing, that all of our children are experiencing now, is different than it may have been several decades ago. And that is both like on a macro level, the stress of kind of our global, just the stress of the globe, and also, which in fairness, all generations face their own version of that, but also just the what it's like to be a child today and growing up with technology and the pressures that our kids do face. So the chronic stress and estrogen is a tough mix, but then also our girls are going through puberty earlier than they used to. So if the average onset of puberty is 11 to 12 years old now, several decades, it was more like 15 years old. And why that matters is because that's a couple of years that girls are losing to sort of practice figuring out the world around them and making sense of social relationships, their big feelings, how to navigate their lives. They're getting slammed with kind of the hormonal changes of puberty earlier and have a lot less real life world experience under their belts to kind of to then make sense of that with higher stress levels and chronic stress. So hopefully that was helpful without going into too much detail, but it kind of is important to know that there is some science underlying this. And this is also new science that we are only like beginning to study the differences between men and female, men and women, girls and boys in the last like several years.
Yeah, yeah, and that is, that may be the double-edged sword, right? Prefrontal cortex that girls develops earlier. We talked a lot about that last month as to why boys struggle so much academically. This might be the other less positive side of those changes occurring so
Mhm.
early. Omar, over to you. Can you help us
Yeah,
understand what Dion touched maybe on social media? Help us expand a little bit more about how it may be linked to those increased rates of depression
yeah,
in girls.
yeah. It's a great question, and then one that parents are really, interested in learning more about. So when I think about social media, I want to highlight that it's not all bad or it's all good, right? So we really want to going back to Dion's point of how do we understand the risk and how do we use the data. So there's like a couple of pieces that we really want to clarify. And one is there's some evidence that girls use social media at higher rates, or that they say that it's harder to disengage from social media. And this is particularly true for things that are like image based. So things where you're scrolling through lots of images or lots of pictures of things, right? But in addition to the time that you're spending, it's really about the content that you're being exposed to, or what you're doing during that time. So if we think about particular risks here, we think about what is being curated into a girl's feed, and how does that feed look different than maybe from my own feed? And that what we see is that there's specific risks for things like body dissatisfaction, right? That there's lots of messaging that can amplify somebody's sense that they're not really happy with their looks, or the sense that other people look better. So this idea of like social comparisons or social perfectionism, right? So there's this real emphasis on standards that are maybe unattainable and that lead to a lot of stress in and of themselves. And then the other piece is really thinking about it's a way to really amplify relational stress, right? So when we think about mechanisms that are really directly linked to depression, we think about those social stressors, and that social media gives us a way to maybe experience stressors on a whole new level. So everything from strangers being able to comment, or people being able to say things that they might not say in person. So it's that combination of what's the content I'm being exposed to. Maybe it's direct messaging around mental health, and maybe those aren't particularly helpful. Maybe it's messages that increase somebody's unhappiness with their status in life, but also this idea of potentially creating or exacerbating social stressors. And the other piece is just the permanence of it, right? That these comments can be there forever. So the algorithms are designed to keep us engaged, so it might be hard to disengage in the moment, but also even if we do disengage, the content can live on beyond that. So it kind of creates this new type of stressor that's really contributing from multiple perspectives.
Yeah, yeah, thank you. Um, Lindsay, I want to go back to you for a sec. Last month we discussed data showing how, again, girls outperform boys academically. Now, again, is this a double-edged sword? Does this performance also come with expectations? And is there a link between those expectations and rates of depression?
Yeah, Shai, I think in general, it's safe to assume that girls and boys, but girls feel expectations in many areas of their life, whether it's the performative expectations on social media, within their social life, at home, but definitely at school. And that this is part of that chronic stress that our kids are experiencing, is this pressure to do better, to do well, to excel, to be the best. So certainly, that is the academic piece is definitely contributing to this, just as the other factors are as well.
Mhm.
Okay. Um, and Omar, I want to have this question here, and then I think we're going to expand on something from Dr. Maria Rodriguez. So,
Sure.
how do societal and cultural expectations around gender roles increase the likelihood of
Yeah.
depression in adolescent girls?
Yeah, it's such a key piece that we forget about sometimes when we think about diagnosis, that there's that piece where you want to say, like, is this atypical given your social and cultural context, right? So as society keeps evolving, what counts as depression keeps changing. And when we think about what Lindsay was just talking about, where um, Cultural expectations shape, what's the appropriate way to respond to something, what's a typical level of stress, what should we worry about or not worry about. So as we keep increasing the bar for what's expected of girls, it really creates this opportunity to miss real distress or real problems. So it's not just a matter of kind of having high expectations for girls, but expecting girls to do more and more and more, right? To excel in all areas of life. When we think about what are acceptable ways for girls to express their distress or their discontent, or to have conflict and to resolve conflict, when we think about kind of the importance that we place on relationships, that there's a gender component there, and when we're kind of socialized to really have relationships be a key part of our identity, or harmonious relationships be a key part. So we're really thinking about girls developing in this context where we're saying these things are important, these things are all important, you need to do them all, and you need to do them really, really well. And it really creates that sense of chronic stress that Lindsay was talking about.
Mhm. And then shifting to another topic, let's go deeper. So Dion, you're a member of the Center for Trauma in the Community. Are girls more likely to experience trauma-related depression compared to boys? And if so, why? Oh, you're on
Oh,
mute.
you're muted.
I do that often. I apologize. This is a really great question because I believe that we cannot have a discussion about depression and not at least touch on trauma and the impact of trauma on lives, young lives. So let me break this down a little bit before I answer the question. First, let's talk about traumas. What is trauma? So trauma are experiences that young people can face that are deeply disturbing or deeply distressful. And this can take the form of things like abuse, neglect, violence, and even a significant loss can be considered a trauma. And then when we take that a little further and start to drill down into trauma-related depression, that is a form of depression that occurs after a traumatic event. And when we're talking about trauma and trauma-related depression, trauma can have a lasting impact on one's mental health and can lead to not only trauma-related depression, but other trauma-related disorders such as post-traumatic stress disorder, which typically occurs when the trauma that is experienced is chronic. And when we're thinking about if girls experience trauma-related depression more often than boys, the answer again is yes. And why is that? Because girls often experience trauma, unique traumas in rates that are not equivalent with boys. And we're talking about things such as sexual abuse, sexual violence, intimate partner violence, or dating violence. We call it a lot of different names these days. And then bullying, which was mentioned earlier in our discussion. And these experiences really heighten the risk of developing depression and can also alter brain development, which we've also touched on a bit and hopefully more later. But and can lead to emotional challenges. So one of the areas that we need to think about is because girls tend to internalize distress, it often increases the likelihood of experiencing trauma-related depression or other trauma-related mental disorders. And so the answer to the question is yes for those particular reasons and factors.
Okay.
Mhm.
I want to expand. You mentioned they tend to internalize. So Omar, let's go to you.
Yeah.
Depression is indeed described as an internalizing disorder. What does that term actually mean? And what are these types of disorders? Why are they so hard to spot?
Yeah, so it's a great question. When we think about clinical child psychology, we group disorders into these two general categories, internalizing and externalizing. And we think of that as where is the distress being experienced, or where is the impact most likely to occur. It doesn't mean that they can't happen across both, but where is the primary distress or the primary impact? So it's really easy when we think about an externalizing problem. You see somebody with conduct problems, disruptive behavior, you see them getting angry, breaking something, or yelling at somebody. Those are really observable behaviors, right? But if we're thinking about internalizing distress, that those are things that we only know if somebody tells us, or if we are really paying attention to what's going on. So the things like my experience of anxiety, my low mood, my self-esteem, my sense of hopelessness, so that those aren't things that are readily observable by other people. So it's much harder for a teacher or a pediatrician or a parent to really catch this unless we're really attuned to what kids are doing, or unless we have that relationship with kids where they're letting us know that these things are happening.
Okay. And then, thank you for that. So then, Dion, linking on that, help us understand both the emotional and maybe the behavioral side of depression in girls, and that are most commonly overlooked.
Sure. The top one that comes to mind um, as a sign or symptom that is often overlooked is irritability, and the way in which girls experience irritability, and um, the way that sometimes irritability can just be misinterpreted as normal teenage behavior, but it could actually be a sign of depression. But because it's not socially acceptable for girls to express irritability and anger, it's often looped into a different category. And so irritability is something that we really need to focus on when we're thinking about emotional signs of a potential case of depression. Um, some other things to consider would be things like persistent sadness or hopelessness, which is something that is a bit more common, and loss of interest are girls who were once engaging in hobbies and socializing with peers. Are they just losing interest in doing those things? We need to be mindful of those signs. And then just this feeling of just low self-worth and feeling guilt, shame, inadequacy, which can lead to a negative self-perception. So when we're thinking about emotional signs, the one that stands out the most as being overlooked is irritability, in addition to the others that I just mentioned. And you mentioned some of the behavioral signs as well. Um, we want to be looking for things like changes in patterns, changes in sleep patterns. Are girls sleeping too much, or are they not sleeping enough, experiencing insomnia? Are they becoming more socially withdrawn from family, from friends, which is similar to something that I just mentioned? And then another thing that we need to focus on is this concept of academic decline. When a young person is experiencing depression, it can impact their ability to focus and concentrate, and that can really cause academic decline. Um, so we want to focus on signs and symptoms of academic decline in young people, girls we're talking about today, who were historically doing well in school. And then finally, risk-taking behavior. Are the girls engaging in behaviors that are risky, like substance use, like risky sexual behaviors and things like that? So those are some of the behavioral signs that come to mind as things that could be overlooked.
Hmm. Okay. Um, and then if I'm just going to put it out to the panel here, we have an audience question. How can a parent tell if the irritability is due to depression versus learning to handle their hormones slash periods? It's an anonymous attendee. Um,
Mhm.
but as a father to a 12-year-old, I'd appreciate that the answer as well.
I would just echo what Dion was saying in terms of we're looking for patterns of behavior over time, right? So
Mhm.
so a lot of these things in isolation can say, well, is it normal? Is it atypical? What's it due to? So we're looking for kind of multiple examples over time. So this might be if you're noticing irritability and it's due to a specific stressor. You might say, I wonder if that's typical for teens. We see some increase in irritability or the way they express themselves, but it's due to something explainable. But if you're noticing the shift in the adolescent being overall more irritable, and that's changing from the way they were before, and it's accompanied by these other changes in mood and hopelessness, and it's impacting academics, that you're starting to put all those pieces together and say, I think this is something different, right? There's multiple areas being involved, and it's staying for longer, not just a couple of minutes or hours. It's staying for days and weeks and months.
Hmm.
Exactly. And I think, and to just piggyback on that a bit, that's an excellent response. And I think you also need to think about how it's impacting functioning. How is it impacting functioning? Is it impacting a young person's ability to perform activities of daily living? Are they able to get out of bed? Are they able to go to school, go to work, do their chores, do their homework? All these things you want to think about. Persistence, pervasiveness, and functioning. Is it impacting function? Those are good ways
Those
to
are
tell
three.
whether or not
Mhm.
it's normal or something else that's going on.
Mhm.
Right.
Yeah.
You know what? I'm gonna be selfish a little bit. I'm gonna ask another question that I've
Yeah.
encountered again as a father of a 12-year-old, and that's about social withdrawal. Again, I understand the principle might be the same, but I'm also noticing that my 12-year-old changes and her social patterns change. So, what role, maybe Omar, let's go to you on this one. What
Yeah.
role does social withdrawal and changes in friendships play in potentially signaling depression? How do we differentiate between what my
Yeah.
12-year-old says, that's just regular drama, that's
Sure.
the word they use, versus withdrawal that's cause for concern?
Yeah, so it's a very similar theme, right? So we want to think about what's typical at this stage in development, and we do see a shift from more kind of family focused, or families are really the entire focus of somebody's social life, to seeing an increase in social life outside of the family. So there's this kind of increased focus and pressure and desire to make new connections, right? So that is typical development. You're also talking about conflict that can happen when we're talking about middle school drama, for example, right? That those are things that you might say, well, some of that happens, and we say that it happens because we see it over lots of kids. So in some cases, we're really talking about um, working with family members, with community members, with schools to say, are we all seeing the same thing? And do we agree that this is something that's typical and expected? And that then helps us understand, when is it different from what other kids are doing, right? So it can be sometimes really hard when we're just focused on our own child or one or two kids. But if we can have that perspective of saying, what are typical 12, 13, 14-year-olds doing right now? And is this something that's expected or not? That sometimes that can be really useful to have a conversation with somebody else. And going back to Dion's point here, we're looking at what's the impact of this withdrawal, right? Are we talking about somebody that's locking themselves and separating themselves away from the family, and it's really impacting those relationships, that ability to feel close, to know what's going on, to just do basic things like live in the same household? Or in the same reason, we can talk about are these friendships that are having really explosive endings every so often, and it's really impacting somebody's uh, uh, social status at school, and it's impacting how teachers see them, and it's impacting their ability to play on sports teams. That in those cases, really saying it's having that widespread impact. So regardless of the cause, we may want to look at it more closely.
Mhm.
Shai, also, I think introducing, I know we'll get to more of this, but we'd be remiss to not sort of talk about the possibility and the importance of actually talking to your children about what they think, right? That we know that talking to your child, have them having a place where they know they can unconditionally show up and be accepted and not scare folks off, and that we can listen more than we talk. And that varies, of course, from child to
Yeah.
child, age to age, but sometimes simply, the ability to say, gosh, when I've been really sad, I've noticed that I get very irritable, like it, and that doesn't feel very good. And someone pointing out something like irritability may not be that you're just a mean nag, right? It's actually maybe something that is a bit more kind and kind of like help focused. So I just want to introduce here that like we want parents to be able to talk to children about what's going on for them, and getting their input and introducing these ideas is definitely a component here. We're not detectives trying to figure out something from the outside. Always we want their input and which is easier said than done. And as
Mhm.
my husband and I are both therapists, and we struggle to talk to our own children about their feelings. So I want to say, like, of course, yes,
Mhm.
easier said than done, but want to just point out there that they are really important team members here.
Mhm. And with that, I think that's a perfect segue. Let's start to get to solutions. So support always, the best support always starts at home. So Dion, maybe start with you here. What are some daily habits that parents and caregivers can encourage that promote mental well-being?
Yes. This is a great question to follow up with Lindsay was sharing, because I'm going to start where she ended with just open communication. I think that we have to get into the mindset, particularly as providers, to think about caregivers as partners in this process. We need that partnership. And young people, girls, need to know that they have a safe space to open up, to share their emotions, their feelings, their challenges, their struggles, their trauma. And if they don't have that at home, who are they going to talk to? So creating that space where they're able to share their experiences, their lived experience without fear of judgment and ridicule is critical beyond anything else that I'm going to say. If we can just get that piece right, I think that that will make waves in the manner in which caregivers can be supportive to young people who are struggling with depression, particularly young girls. Because again, if we go back to this whole concept of girls internalizing distress, that's what they're doing. It's inward. They're not expressing it externally. And so if they also live and study in environments where they're not able to do that openly and freely, it's just going to exacerbate the problem. So I really, really love what Lindsay shared about this open communication concept. And then some other things that I think caregivers can do to promote well-being amongst young people is make sure that they have regular routines, sleep routines. I mean, we just cannot underscore the importance of sleep. And I just don't know that teens get enough of it because they're on social media all night, or they're on their phones, or they're doing whatever they do at night. But we cannot underestimate the importance of sleep. They need a consistent sleep routine. They need a healthy diet and nutrition. They need regular physical activity. And these are all things that parents can model because parents should be doing these things themselves. And then things like journaling, just giving girls another avenue of expressing themselves and helping them to sort of deconstruct their experiences and having a way to put their thoughts and feelings down on paper to get it out. And then, of course, we always have to talk about mindfulness and relaxation. I mean, these are things they can do wherever they are: mindful eating, mindful walking, mindful studying, mindfulness, and just understanding and the importance of like deep breathing, engaging in mindfulness and meditation. And I know that's not for everyone, but for those who are able to do it, it's really very helpful, a very helpful technique. And then I'm just going to go back to what we discussed earlier about social media. Caregivers can play a critical role in just limiting that screen time, and especially social media use, because we just heard about the impact that can have on emotions and how that can lead to depression with just comparing yourself to others and always seeing these highlight reels, which is something I learned from a young person, where they just see all of the good and they don't understand that that's what you're seeing, and it's purposeful. You're seeing the good, but that's not real. So things like limiting that screen time could be very beneficial for mental health. So these are just some of the types of things that I think caregivers can sort of adopt and advocate in their homes. But I still go back to my number one is that open communication.
Mm-hmm. Yeah, thank you for that. By the way, social media did come up in the Q&A as well. So I'm posting a link here in the chat. We did a session with clinicians and a community leader from the Log Off movement called How to Be on Social Media Without Being Sad. So I would encourage everyone to go and check that session out for much more on social media and its impact on mental health and some best practices. Again, not just from clinicians and us adults, but from actual youth who are experts on the matter. Lindsay, if a caregiver spots some of the signs we discussed above, what is the best way to start a conversation about mental health, about depression?
Yes. So a couple of key things to remember about how to show up for your child and make this open communication more likely to succeed. And of course, like, it's never too late to start doing this, right? And it's never too early either. So you're neither late nor on time or whatever. This is just, it's always, you can always practice these things. So listen more than you talk, be an open ear, listen places other than directly face to face, like while you're driving, while you're engaged in an activity that you guys enjoy together, like going for walks, doing a craft, working on a project around the house, um, playing a sport, eating dinner. Listen more than you talk. Validate your child's feelings and experience. What that means is your experience and your feelings make sense. They are valid. Apologize when you are wrong, when you've made a misstep. None of us are going to get this perfect, and it's okay. When we model that we can apologize, that we have owned up that we didn't do something as effectively as we wanted to or we should have, we know that kids move on really quickly, and it's a wonderful skill to model for our kids. And then, especially for girls, praise the crap out of them. Praise more than we criticize. Make your praise loud, make it public, make it unconditional. I have to just say here, my parents are logged on right now, and I know I have to silence my phone because my mom will text me about how smart I am, how pretty I look, how proud she is of me. And whether you are like a hands-on example of how you raise strong women, whether they are 12-year-olds old or 42 years old, let them know that you are here and you are their biggest fan. So those are, you can take that, embody it as you go into your conversations with your kiddos. And then, ask little questions about how, practice little specifics about the way that things make them feel, about like how you have felt or your own experience. Sometimes it's enough to say, I remember feeling like very, frustrated with how irritable I was, right? Or very, concerned about how others perceive me. And maybe that's just it. You show yourself that you can have a lived and shared experience and open that doorway. And let them know that the most important thing is letting them know that you are here and you are non-judgmental.
Wonderful. Well, the Hendersons are regular attendees at all of our sessions.
Biggest fans,
We,
yeah.
we appreciate their presence as always. Omar, cognitive behavioral therapy. I know the Child Mind Institute practices that at Ford Health. We do, Leon, I'm sure in your practice as well. It's considered best practices in treating depression. Are there any CBT skills, right? Cognitive behavioral therapy skills that caregivers listening today or educators can adopt and share with their girls? Any resources or links you can share as well?
Yeah, absolutely. So when we think about what's the foundation for CBT or cognitive behavioral therapy, we want to make sure that we're starting from exactly what we were just talking about. So that idea that kids feel listened to and they feel like we can validate their experience, right? So you want to have that as a foundation. And then on top of that, you might say, well, what are additional things that I could do now that I'm listening and validating their experience? So with CBT, we think about it's the foundation of it is that our emotions and our behaviors aren't directly related to situations, but they're related to how we perceive those situations. So a lot of what we're trying to do with CBT is really understand what is this kid's perspective? How are they seeing the world or relationships or themselves in a way that makes their feelings make sense? And if we could put that into words, that's like a great example of validation, right? Like, no wonder you're feeling like this because you're seeing A, B, and C happening. No wonder it feels like you're never going to have any more friends because this thing just happened and you're remembering all of the other friendships that didn't work out. So we're kind of helping them see that there is this perspective that's contributing to their feelings of hopelessness or despair or sadness. And then the other piece that we can do is really think about, can we do anything to start to increase this perspective or modify it or move it in a different direction that's more helpful? So if we think about what's so beneficial about talking to friends or talking to people that we care about when we're feeling bad, part of it is social support just in and of itself, right? But the other piece is that it gives us the ability to see the situation in maybe more helpful ways, that we get other perspectives. So this can be as simple as listening to your child and then thinking about, can they get to more helpful ways to seeing the situation? Can they think about other things that they might want to focus on? What are pieces that they're maybe forgetting or ignoring? How would they talk to a friend in the same situation? So it's not really just saying, think positively, that's an oversimplification, but it's saying, what are we focusing on right now that it's making us feel so bad about it? And are there other things we could be focusing on as well that might make us feel better about it? So it's kind of guiding kids in understanding that perspective and then helping to shape it or move it in a more helpful direction.
Right, reframing. Um, can one of you elaborate a little bit on DBT? An audience question here. We often get asked that in our practice. Um, what is DBT? How is it different from CBT? When is it more effective? Maybe Lindsay, if you're comfortable with that, because you and I just had a conversation about DBT last week.
Sure. I guess the short answer, really, honestly, my thought is that DBT is an offshoot of CBT. And so there is more similarities than differences in the two. And, I welcome Omar and Dion to jump in here with any thoughts, but I think getting into the weeds too much about how those differ is actually less helpful than just diving right into to being aware of your emotional experience, that mindfulness, like you talked about, Dion, to labeling and understanding, putting words to what you are, what your feelings are. Omar, like you just said, those are critical and those are consistent between both. They're also, it's about coping skills. It's about tolerating discomfort. It's about riding the wave of a feeling, knowing that it won't last forever. It's about getting comfortable with the uncomfortable. And again, like I don't know. Please, my colleagues, please disagree with me, but I feel like differentiating too much beyond that is not as useful as just diving right into getting going with being more familiar with how your thoughts and feelings are connected.
Absolutely.
Yeah.
I agree. Perfect response.
I want to go over to you here. So we had a question from Robin Alexander. Are girls pressured more academically than boys? I think short answer, Robin, without getting into too much of the nuances, yes. Yes, they are. Girls are much more prone to comparison. But Dion, I want to ask you, what coping mechanisms can girls be taught to deal with this academic pressure and this need for perfectionism?
Some things that come to mind are things like time management skills. We really need to teach girls how to just stop and let's reduce this overwhelming pressure to do everything at once. How can we break it down into smaller, more manageable, more achievable pieces so that we can alleviate some of those feelings of just being overwhelmed with academic pressures? So just stop, breathe, break it down, and then work towards that. I do that a lot in my practice with the adolescents that I work with, teaching time management skills. It's really important. It's important for adults too, by the way. And then another thing is setting realistic expectations. What are your goals? And how are you able to identify and set achievable goals and understand that perfection is not necessary for success? I deal a lot with perfectionism with some of the young girls that I work with clinically, and it's not achievable. So we have to help girls understand that it's not achievable, but it doesn't have to be achievable for you to be successful. So setting those realistic expectations and diving into a little bit of what Omar was sharing about CBT, this whole concept of cognitive restructuring. A lot of it is how can we think about things differently that will promote healthy experiences, healthy relationships, and how do we help girls recognize and challenge unrealistic thoughts? That's a key coping strategy for managing perfectionism, which is what I was just sharing. So cognitive restructuring, how can we look at this differently so that we can feel better? And then the one that I love that I promote a lot and advocate a lot is self-compassion. Love yourself. How can you get into a process where you just, again, a lot of this is about stopping and just thinking. Stop, think, breathe, and love yourself. Express compassion for yourself. Extend grace for yourself and understand that you are going to make mistakes. And guess what? It's okay. We all make mistakes. That's how we learn. So that self-compassion, encouraging self-kindness, and helping young people understand that if they don't meet the high expectations that they have for themselves, it's not the end of the world. Stop, take a break, and recharge, and let's start over. It's
Mm-hmm.
okay. Um, Last two things I'll mention is the peer support, which I believe Omar talked about, is how do we build positive support systems for young people who are also experiencing these academic pressures and stressors. They understand what it's like. So how can they work together to overcome those stressors? And then I mentioned this earlier, so I won't go into detail. Relaxation techniques, mindfulness, meditation,
Mhm.
deep breathing, or just stopping to take short breaks to just say, let me just stop and recompose myself so that I can think thoroughly about my next step. So those are just some of the coping mechanisms that come to mind when we're thinking about specifically about academic pressure and perfectionism.
Mhm.
Mm-hmm. Mm-hmm. And then I think there's one more thing, and maybe Lindsay, you can touch on that, is helping our girls learn how to set healthy boundaries in their personal lives and their online lives. Any tips or skills on that?
Yeah, I think the biggest thing, and listen, I'm as guilty as the next person is modeling boundaries and how we set limits and take care of ourselves. As Dion said, modeling self-care like sleep and nutrition and screen time, that we need to do that for our children, exercise. We also need to model how we are engaging with the world around us, whether through screens or in real life interactions. As I was prepping for this, came across, someone who really talked about the power of female modeling either pushback or limit setting with some of the like sexism and gender kind of stereotyping that is unhealthy for our girls to hear or see. So whether that is sort of your relative at Thanksgiving that you only have to see once a year, but man, he says some things that just don't sit well with you, kind of inappropriate and respectful and polite response that shows your daughter, well, my mom's not taking this, and she can do so in a way that is again respectful and appropriate and polite, whether it's that or it is modeling strong female like role models and what we can do with the world, or it is actually putting your money where your mouth is and putting your phone aside and talking to your kids about how engaging in technology use, social media, makes you feel. I can certainly talk about how, if I spend too much time on X, I notice my mood goes Y. How do you feel? Like starting that kind of social media literacy discussion and hygiene discussion early and making it like a frequent discussion topic of conversation, and then modeling that behavior for yourself,
Mhm.
for your kids to see.
Excellent, excellent. So we spent quite a bit of time talking about support at home. I want to expand it,
Yeah.
and talk about when support outside the home is needed as well. So, Omar, what are the key indicators that
Yeah.
a girl's mental health issues require professional intervention?
Yeah, so we want to go back to what we were saying before, which is like what's the severity of this problem? How long has it been there? And what's the impact that it's having? Right. So at some point we were saying there's enough evidence here that something has changed or that something's not working. And I would encourage families to really trust their own instincts as well, right? That part of what they might notice is that they feel like they can't handle what's going on or they don't know what to do about what's going on. So part of it is recognizing that the child has a high level of distress, but there might be family level distress too, saying we don't really know what to do here. The other piece is really thinking about how can I rely on my networks, right? Can I rely on my children's teachers or pediatricians? Can I use resources like Fort Health and childmind.org to really think about what is already out there that's designed to kind of help parents think through these situations? And then last but not least, thinking about if we really have questions about whether this is okay or not, it doesn't hurt to really, again, use some of the resources that are already there, potentially at schools, potentially with pediatricians, or also reaching out for professionals for the purpose of consultation and saying, is this something that we should be doing something about? Can we do something from a preventative standpoint or on a short-term basis that we don't have to know 100% that somebody needs long-term treatment before we can benefit from some professional supports?
Okay, thank you for that. We have had multiple questions about the role of schools, the role of educator. Elliot, Patricia, a few others here in the audience have asked. So, Dion, let's maybe go to you. Can you help guide educators listening in? How can they at the school spot the sign of depression among a student, start the conversation? Oftentimes, we know from our work that schools are often the first place outside the home when mental health challenges are noticed. But then the school counselor, the school psychologist has to work really hard to convince the parent. So, how to start the conversation, and how to help encourage this family to seek out help. That's three questions in one. I apologize.
Yes. I think that I would start by saying that there has to be a shift in the way that we think about the role of schools and mental health. And I think that schools need to begin to have a wellness mindset. So typically, schools have counseling programs. Some of them work well, some of them may not work as well because they may not have the support, resources, infrastructure, a number of reasons. But I think that offering those counseling services, or maybe bringing in external support, clinicians who can help the schools provide those services, things like providing mental health education, providing teacher training, so that educator training, so that they can understand signs and symptoms of depression and other mental disorders. And then they not only are able to identify and those signs, but also know what to do next. This is what you were talking about, Shai. It's one thing to identify if a girl is all of a sudden withdrawn in class, not engaging, not participating, or maybe tearful or irritable, which is what we've been talking about today. It's one thing to identify those signs and symptoms. It's another thing to know what to do with that. And that's difficult for some educators as they're trying to educate. They're there to do,
Mm-hmm.
and having to deal with all of these mental health components is another piece of the puzzle. And so providing sort of educator training around how to recognize signs and symptoms and what to do with that, and who to go to seek
Mm-hmm.
additional support. And again, like we talked about earlier, schools supporting and developing peer support programs are helpful. And then finally, I'll just say, just as we talked about what caregivers can do, I think it's important for us to understand that educators, administrators in schools also need to create safe and open environments for young people to talk and share and express
Yeah.
themselves. And it doesn't always have to be the mental health professionals. It could be the coaches who are trained to do this. It could
Mm-hmm.
be other professionals in the school that students trust. That's a big thing in some of the research that I've conducted. Students, young people won't talk to you if they don't trust you. So figuring out a way to build that trust among these professionals who are in the school every day is really critical, so that they are able to relax and talk and just share how they're feeling in a trusted, open, honest, transparent environment. I think are some of the ways that schools can play a role, but starting with that wellness mindset, and that's
Mm-hmm.
integrated throughout everything.
Yeah.
Mm-hmm.
I think that's such a key piece. I thank you for bringing that up because I think it really is a shift in terms of not expecting teachers to provide treatment, but saying like we're talking about learning skills to that are going to be helpful for life. And we've developed a couple of resources exactly with that purpose in mind, really saying what are skills that can be taught within the classroom as part of a way to develop or focus on well-being, focus on mindfulness, focus on coping, and that those are things that can be done at a community level.
Exactly.
Yeah.
Exactly.
I want to walk through the entire spectrum of care here. So we talked about support at home, we talked about schools, we talked about CBT. And Omar, Lindsay, I'm going to direct this to both of you. When we started working together on building what became Fort Health, we discussed how virtual care was only suitable for mild to moderate levels of acuity, but I think the landscape and the evidence has been shifting, and now we're seeing virtual care protocols effective on high acuity patients. So,
Yeah.
can you maybe provide an overview on levels of acuity, levels of care, and the relationship between them, and what level of care is
Mhm.
appropriate for what level of acuity?
Mhm. I'm happy to start. So I think it's
Yep.
easiest to start with the highest levels of care. So when you think about inpatient or residential treatment, right, that there we're often talking about kids that are at risk for harming themselves, for harming somebody else, kids that really have a hard time functioning in the community. So we often think of kids that can't really go to a regular school, that can't get through a regular day, that need much more structure, much more support, much more oversight and supervision, that they might need group treatment and individual treatment multiple times throughout the day, that there might be medication changes that we're talking about. So really a high level of care, but the goal is to do that in a short amount of time, right? So the goal is always to say, what's next after that inpatient and residential. Then we can look at the other end of the spectrum and say, well, what's typical outpatient therapy look like? And that might be like a 45 to 50-minute session once a week, right? So somebody that's maybe functioning well in lots of areas of their life, they have good supports at home, but there are these ongoing things that can be addressed, and those can wait for about a week. There aren't kind of imminent dangers or risks that are showing up on a regular basis. There may be occasional needs for additional sessions. And then there's this big area in the middle that I'll defer to Lindsay on, because I think you're much more of an expert on this. But we have lots of names for everything that happens in between that. So whether it's an intensive outpatient program or a partial hospital program or a day treatment program, that those are really thinking about trying to bridge that gap between kids that can't be in the community and kids that are being seen once a week.
Thank you, Omar. Beautiful. And the ever popular kind of mental health response to this is that it was really a case by case basis as far as like what is the very best match for what your needs are. So, Shai, I love that you brought this up, because I think there is in my opinion, someone who's been in telehealth leadership for about a decade, like there's a misconception of telehealth is appropriate for mild to moderate only. Not only are we seeing real evidence that there can be more moderate to severe treatment protocols that are very successful in a remote setting. This is about like the fit, right? Not only with your child or you as an individual and what your style, preference, and needs are, but also what the provider, the actual clinician, their style, preference, needs, background, skill set, training. So, to put it kind of like a little bit bluntly, I never, as a psychologist, have any reason to place hands on a patient. Like that is never the case. And so, if there is if we take away that, there is a lot of room to be kind of meet in the middle with my skill set over Zoom as opposed to my skill set in an office. So I think really being cognizant there's never a one size fits all, and knowing both what your style is, like an IOP on Zoom is a very different experience than an IOP in real life. Figure out what it is that is possible for you to participate in, and also what you like and prefer from a personal basis. So
Yeah.
Excellent. Last question here. Let's talk about medication. Now, none of us here are psychiatrists. We're not going to get into details, but again, we start from the data. Antidepressant prescriptions for adolescent females increased almost 130% between 2020 and 2022 when compared to a period between 2016 to 2029. Dion, as a psychologist, again, not a psychiatrist, when do you recommend to your patients to consider maybe seeing a psychiatrist and considering walking down the path of medication?
Absolutely. And I think that this is a very important question because as psychologists, we engage in collaborative care. So I work very closely with psychiatrists in my practice because it's important for us to make sure that we're treating the patients or clients well. And so some of the things that I consider when I think about making a referral for a psychiatric consultation are things like severity of symptoms. Are the symptoms so severe that they're significantly interfering with daily functioning, which is something that we talked about earlier? How long has the patient been in therapy, and have they made any progress, or is the progress only minimal? And if that's the case, we may want to think about a psychiatric referral for a consultation to see if medication might be able to get the patient to a level where they're actually able to engage in therapy more appropriately. And then things like, is there a presence of physical health risks? Or is there suicidal ideation? Is there self-harming behaviors? Is there an inability to eat or sleep? That's something else that I may consider when I'm thinking about referral. And then the last thing is co-occurring disorders. In addition to mood disorders or anxiety disorders, if there's substance use disorder, that may be another factor to consider when thinking through talking to families about potential psychiatric consultations. So these are some of the primary areas that I consider when I'm making that decision with families. But there's another side to this coin is, yes, families may agree to do this, but then what? We need to also walk them through the process of helping them understand what questions should they ask the psychiatrist when they get there to that consultation, because that's just as important, because sometimes they don't understand a lot about medication, or they may not. And so they're very important questions that we need to equip our families with when we send them or refer them for psychiatric consultations. And I mean, I don't know if we have time to get into that, but there's a list of questions that I equip my families with as well.
Probably not, but I tell you what, if you send those questions to me, I will post it.
Yes.
So we share recordings of these sessions typically within 24 hours afterwards. So we're going to send an email to everyone that registered. There's going to be a recording. Dion, if you can send me those questions, we will post
I
that
will.
on the recording page. I want to be respectful of everyone's time. So thank you to our esteemed panelists. Thank you to our guests. There's 106 questions here that we did not get to, and I apologize, but hopefully we managed to answer at least some of your questions here. In terms of resources, childmind.org, Child Mind Institute, that is the leading free public resource on anything mental health for kids and adolescents. Highly recommended. Some of the best content you will find on the web. Check out forthealth.com, our resources section. We have dozens of articles and a lot of these webinars that we do with the good folks at Childmind and researchers and clinicians from everywhere. And again, stay positive out there, model behaviors for your kids. Thank you for attending, and we'll see you next month for our last session in our Disparities series. Thanks again. Bye now.
Thank